Hello and welcome back to MediFriend. Today we are going to talk about a very serious but important heart condition called dilated cardiomyopathy. Let's understand this in a very simple way. Dilated cardiomyopathy is a disease where the heart muscle becomes weak and enlarged. The word dilated means stretched or enlarged, and cardiomyopathy means disease of the heart muscle. So, in this condition, the heart muscle stretches out and becomes thin and weak. Normally, your heart works like a powerful pump. Every beat pushes oxygen rich blood to your entire body. The left ventricle, which is the main pumping chamber of the heart, is responsible for sending blood to all organs. But in dilated cardiomyopathy, this left ventricle becomes enlarged and cannot squeeze properly. Because it cannot pump strongly, less blood reaches the body. When the heart cannot pump enough blood, the body starts to suffer. That is when symptoms begin. In the early stages, many people may not notice anything serious. They might just feel tired more often than usual. But as the condition worsens, symptoms become more clear. A person may feel shortness of breath, especially while walking, climbing stairs, or lying flat. Swelling can appear in the legs, ankles, and feet because fluid starts building up. Some people feel chest discomfort, others feel rapid or irregular heartbeats. Dizziness and fainting can also happen in severe cases. Now, the important question is, why does dilated cardiomyopathy happen? There are many possible causes. Sometimes it runs in families, which means it can be genetic. If a close family member had this condition, your risk may be higher. Viral infections can also damage the heart muscle. Certain long-term alcohol use can weaken the heart. Some chemotherapy drugs used for cancer treatment can affect the heart muscle. High blood pressure that is not controlled for many years can also lead to this condition. In some cases, doctors cannot find an exact cause, and that is called idiopathic dilated cardiomyopathy. When someone comes to the doctor with symptoms like breathlessness and swelling, the doctor will first examine them and listen to the heart. To confirm the diagnosis, several tests are done. An echocardiogram, which is an ultrasound of the heart, is one of the most important tests. It shows whether the heart is enlarged and how well it is pumping. An ECG can detect abnormal heart rhythms. A chest X-ray may show an enlarged heart. Blood tests can help check for infections or other underlying problems. In some cases, doctors may order a cardiac MRI or even a heart catheterization for more detailed evaluation. Now let's talk about treatment. Dilated cardiomyopathy cannot always be completely cured, especially if the heart muscle is already damaged. But it can definitely be managed, and many people live long lives with proper treatment. Treatment mainly focuses on improving heart function and reducing symptoms. Doctors usually prescribe medications that help the heart pump more efficiently. These may include ACE inhibitors or ARBs to relax blood vessels and lower blood pressure. Beta blockers help slow the heart rate and reduce stress on the heart. Diuretics, also called water pills, help remove extra fluid from the body and reduce swelling. In some patients, blood thinners may be needed to prevent clots. If the heart rhythm becomes dangerous, a doctor may recommend a device like an implantable cardioverter defibrillator, which can prevent sudden cardiac death. In very severe cases where medications do not help, advanced treatments such as a ventricular assist device or even a heart transplant may be considered. Lifestyle changes are also very important. Patients must reduce salt intake to prevent fluid buildup. Alcohol should be avoided. Smoking must be stopped completely. Regular light exercise, as advised by a doctor, can strengthen the body. Managing blood pressure, diabetes, and cholesterol is extremely important. One very important thing to understand is that dilated cardiomyopathy can lead to heart failure if not treated properly. That is why early diagnosis and regular follow-up with a cardiologist are very important. If someone in your family has unexplained heart failure or sudden cardiac death at a young age, it is important to get screened. The good news is that with modern treatment, many patients with dilated cardiomyopathy can live stable and meaningful lives. The key is early detection, proper medication, and a disciplined lifestyle. So if you ever experience unusual shortness of breath, extreme fatigue, swelling in your legs, or irregular heartbeat, do not ignore it. Get your heart checked. Your heart works nonstop for you. Take care of it. Thank you for watching MediFriend. If you found this video helpful, make sure to like, share, and subscribe for more simple and clear medical information.